Good morning, Andrew. The numbers, unfortunately, moving in the wrong direction as Delta is the predominant variant here in the United States. Nationally, cases are up about 30% week over week, according to the latest CDC data. Just under 18,000 now being recorded each day in the U.S. Of course, that is way fewer than we saw at the peak of this, but it's going in the wrong direction. Hospital admissions now are also rising, up 15% week over week to more than 2,000 a day. Deaths, luckily, still at the trough at about 183 per day. Now, the states with the highest infection rates are ones where we do see Delta really predominant and also see lower vaccination rates. The red there is where the CDC says the highest transmission is happening in the country. States like Arkansas, Missouri, Florida is a real worry right now. Louisiana and Nevada all seeing the highest per capita case rates right now, whereas areas in the Northeast and some around South Dakota, also in the blue there, seeing the lowest transmission right now. Now, boosters, of course, a huge topic since Pfizer came out last week saying that it has data suggesting we need boosters. Now, the company is meeting early this week, potentially today, with U.S. health officials to discuss data around booster shots. This as yesterday, Israel coming out saying it plans to offer booster shots to folks who are immune compromised after the data there, which is what Pfizer's relying on, suggested that the people who were vaccinated first and also folks who have weaker immune systems are the ones that are seeing more infection. Guys?
So, Meg, but just to be clear here, we're still talking about the unvaccinated that are primarily both transmitting this and that are, unfortunately, the victims of this. We're not seeing massive breakthrough cases.
No, I mean, 99.5% of COVID deaths are in people who are unvaccinated. And so the really good news about the vaccines is that they protect against severe disease, in particular from Delta. Now, as for the rate of breakthrough cases for infection, we really don't know that quite as well because the CDC doesn't track or make public those data. But you do see that the high infection numbers are in states with lower vaccination rates. So it does track. That's where this is spreading.
And is there any conversation about either surging efforts to try to get more vaccination in those states and implications for employers in those states?
Yeah, that's a really interesting question. I mean, they are going person by person, door to door in some cases in these areas, focusing on the local areas that have the highest risk. Trying to get folks to get their first vaccines. That's why there was such an uproar about this talk about boosters, because there is still such a focus on getting people just to get vaccinated in the first place. You know, the question about employers, they're trying to involve them as well, because they find the more convenient you can make these shots for people, the easier it will be for them to get them, obviously. And then the question, of course, of full approval comes into play because a lot of employers are squeamish about requiring vaccinations of an emergency use authorized vaccine that's not fully approved, even though folks like Dr. Fauci make the argument there's very little difference there in terms of the amount of data we have.
I know we got to run, but in terms of schedule timeline for a full approval, if one is to come, what do you think the earliest we could expect for that to be?
You know, we really don't know, Andrew. Analysts were thinking that they would come this summer potentially, but we just haven't heard any signal from the FDA on this. And we know that the companies are still sending in the rolling applications. And so we don't know exactly when the FDA is going to act on this, but there is mounting pressure. So hopefully they'll give a sign soon.
Shepard Smith here. Thanks for watching CNBC on YouTube.